applying radiobiology and protection to radiotherapy.
For many years, radiation therapy has been shrouded in mystery. This is probably because of humankind's fear of cancer, as well as the negative connotations often associated with radiation.
Radiation therapist and the technologies member of the radiation oncology team needs to ensure that the radiation is used in a manner that increases its therapeutic effectiveness while giving physical and emotional care to the patient.
Cancer and cancer treatment. About 1 in 6 Americans dies of cancer, a cause second only to heart disease. 1,300 people die of cancer each day. There is probably no single cause for cancer. Today, scientists still search for answers to the potential causes of cancer. What makes cancer difficult to treat is that malignant cells from the primary tumor spread to other sites within the body and form secondary or metastatic tumors. For many years, radiation was regarded as a last resort to treat the tumors. But today, about half of patients with malignancies receive radiation therapy alone or in combination with another method of treatment such as surgery or chemotherapy. Radiation therapy is limited when a tumor is located close to a critical organ that is more radiosensitive than the tumor. The goal of radiotherapy is to deliver a sufficiently high dose of radiation to sterilize tumor cells with minimal damage to surrounding normal tissues. Radiation does not distinguish between normal tissue and tumor tissue. Therefore, it is a random interaction.
The development of high-energy machines are now capable of megavoltage, or millions of electron volts, also called as MeV, rather than the orthovoltage before, that has maximum energy of 500 kV. There are 3 major advantages in using megavoltage beams over the orthovoltage beams for the treatment of deep lesions. First is the megavoltage beams provide greater beam penetration. Second is the greater penetration translates also into a lower skin dose, or also known as skin sparing. Third is the megavoltage beams provide less penumbra. Penumbra refers to a loss of sharpness at the edge of the radiograph. Also refers to an area of dose gradient at the edge of a beam. With a large penumbra, a larger field size must be used to deliver a uniform dose to the tumor. This also increases dose to surrounding healthy tissue. Now let's go to the other uses of radiation. First is the scientific and educational uses of radiation. There are many scientific and educational uses of radiological materials. Examples are radiocarbon dating, used to determine the age of anthropological artifacts. Others are chemical tracing and sterilization. Second is the security devices. There are few common devices used for security that involve X-rays. They are generally regulated by federal and state agencies.
Household products. Some products you own and use regularly might contain radioactivity or emit radiation. They are an example of the many ways radiation use benefits our modern society. When they are used according to their instructions for use, you are not exposed to radiation. Food irradiation. Food irradiation is done to destroy foodborne bacteria and parasites and extend the shelf life of some foods. The Centers for Disease Control and Prevention reports that at least a few hundred deaths and up to 75 million illnesses occur each year as a result of the bacteria and other pests in food. proper food handling and cooking are ways to minimize the chance of getting sick, but are not enough, and food irradiation therefore provides an additional level of safety.